A Speedy Recovery by Ashleigh, Dana, Davina and Thara. Today we will be exploring the effects and mechanisms of modafinil and its role in managing narcolepsy, ADHD and the treatment of drug abuse. But first, what is modafinil? Modafinil is an oral wakefulness-promoting agent which is prescribed in patients with sleep disorders such as chronic sleep apnea and narcolepsy. It has also been implicated that modafinil may improve cognitive dysfunction in such disorders as attention deficit hyperactivity disorder. The exact mechanism of modafinil is currently unknown. A Cochrane review by Minzenberg and Carter in 2008 analysed the chemical mechanism of action of modafinil on the brain. This review concluded that to date, the only neurotransmitters to which modafinil directly binds to is the dopamine and norepinephrine transporters to which modafinil has inhibitory effects. The drug also has a primary effect of increasing levels of norepinephrine and dopamine, as found by St. Hilaire and colleagues in 2001. Weiser and Erickson in 2005 postulated that the increases in dopamine at the D1 and D2 receptors may also lead to an activation of adrenergic receptors, and these neurotransmitters all mediate waking and activity. While secondary effects of modafinil demonstrated by Ferraro and colleagues in 1997 produce an increase in glutamate, serotonin and histamine, and a decrease in GABA and hypocretin. Modafinil has similar actions to sympathomimetic agents such as amphetamine and methylphenidate in the central nervous system, but varies in its structure and pharmacological profile. The chemical structure of modafinil elicits enantiomers, the L isomer and D isomer, to which each have differing pharmacokinetics. These enantiomers exhibit linear kinetics upon multiple dosing of 200 to 600 mg a day, with steady kinetics reached after 2 to 4 hours of dosing. Absorption. Modafinil is administered orally, with its absorption reaching peak plasma concentrations within 2 to 4 hours. Food has little effect on the overall modafinil bioavailability, but it delays absorption for an hour with food. Distribution. Modafinil is well distributed in the body tissues and moderately binds to plasma protein albumin. Metabolism. Metabolism of modafinil primarily occurs in the liver via amide hydrolysis. The elimination half-life is 12 to 15 hours in the L isomer, which is longer lived. Modafinil is also metabolized to a lesser extent through the induction of metabolizing enzymes such as cytochrome P450, 3A4, 2B6, and 1A2. Elimination. The inactive metabolites are excreted through the kidneys in the urine. Now we will delve into the applications of modafinil in different pathological states. Narcolepsy in particular is characterized by daytime sleepiness and sudden attacks of REM sleep, with an absence of non-REM sleep resulting in disruptions to daily routine. The cause of narcolepsy is definitively unknown. However, it has been implicated that a deficiency in hypocretin, a neurotransmitter that regulates arousal and wakefulness, may be the cause. How does modafinil treat narcolepsy? A clinical trial by Fry in 2008 assessed modafinil against a placebo in 2 tests, including the multiple sleep latency test and the maintenance or wakefulness test. These results revealed that the use of modafinil showed a significant enhanced ability to remain awake on the maintenance of wakefulness test when compared to a placebo. How does modafinil treat drug abuse? A study by Martinez and colleagues in 2008 suggests that modafinil in combination with individual behavioral therapy was effective in decreasing cocaine use days in participants without comorbid alcohol dependence and reducing cocaine craving. Modafinil has also been implicated for the treatment of ADHD. A study by Turner and Clark in 2005 observed that modafinil improved cognition and attention without producing side effects commonly experienced by drugs such as amphetamines. A study was carried out by Amiri and Mahabadi in 2008 to determine the efficacy of modafinil use in comparison to methylphenidate, with results showing modafinil to cause fewer adverse effects and less dependency potential compared to methylphenidate, and it also showed significant improvements in the symptoms of ADHD. Although modafinil is FDA approved, there are potential liabilities of modafinil in terms of abuse. Nora D. Foucault, director of the National Institute of Drug Abuse, showed evidence that Provigil might be addictive. In her study, 10 healthy individuals were either given the drug or a placebo, with results observed with a PET scan. The scans showed that Provigil causes blockage of dopamine transporters, leading to an increase in the amount of dopamine in the brain, therefore acting the reward mechanism of the brain. These mechanisms are also triggered in the consumption of addictive drugs such as cocaine and methamphetamine, but at a faster rate and more strongly, in comparison to Provigil. This showed that the changes in dopamine concentrations in the brain with modafinil use was similar to dopamine concentrations with cocaine use. In conclusion, while modafinil is effective for its purpose, future directions including further study into the exact mechanism of action of modafinil is required in order to understand its efficacy and possible further potential.